Hi friends, I would like to share about the recent medical procedure that I underwent on 23rd of September 2022. There is a little history that I have to tell you before the procedure that I underwent. Since about an year back, I would join my friends who would walk around the apartment and see that after about a circle about half a kilometer, I would feel I exerting myself. I'm feeling a little tired, and then I would let them pass by. They would go around doing brisk walking, and I would walk at my own pace. I thought it was a sign of aging. Then it started getting a little difficult and difficult. And recently, I had gone to a family trip to Chikmagalur in Bangalore, which is a beautiful scenic place. And I would see that me and Uma, uh, my wife, we would walk, and I would see the upslope. When I would walk, it would be so exerting that I would sit down, take a couple of deep breaths, a minute or two of rest, and then again walk another 50 steps. So I thought it is getting worse, and it's very difficult to lead a life like this where a little bit of walking would exhaust me. Then luckily I talked to my uncle who is a gastroenterologist in USA. So he told not to ignore, and then on that particular day he checked my BP three times, and it was around 150 by 100, 145 by 105, like that. So it was a little bit on the higher side. My BP has been higher, around 130 by 90, 140 by 100 was kind of common reading that I was used to. So he told better to get the cardiac check done, because I am nearing 50. I'm 48 now. So he told around 45 plus, it's better to get one level of cardiac check and whole body check, comprehensive check done. So I did that. Me and Uma went to meet Dr. Prasanna Katti. He is a renowned cardiologist in South Bangalore. So he checked my ECG activity, and he told it was looking abnormal compared to 6 months back when I had gotten it checked. So it was erratic according to him, and he told better to get a test done immediately, troponin test. If there is any rupture to the heart blood vessels, some protein would get released uh, in the bloodstream, and that would give a sign that some damage has occurred or not. So luckily the test came negative, but the constriction needs to be addressed. So he told let's get the angiogram done so that a clear picture can be found about what is happening inside. So the very next morning around 7 a.m. in Apollo Hospital, Seshadripuram, which is a good hospital and good set of doctors. So he led the team, Dr. Prasanna Katti led the team, and they did the angiogram, and they saw that LAD, left coronary artery descending, one of the main blood vessels that supplies to the heart, was 95% constricted. There was a block there. So he told it is just a nick of time that you have arrived, so it's better to get the stent procedure done. And very quickly me and Uma decided that this is a procedure that I would like to go for, because to improve the quality of life, and walking is one of the essential things that we need to do, and any deterrent to that is going to be difficult in the long run. Me nearing 50, if I'm going through this, think about a couple of years later how difficult it would be to walk, and feeling exhaustion all the time is something that I did not want to have in my life. So immediately underwent the procedure, angioplasty, and while inserting the stent itself, while the Dr. Prasanna Katti kept in conversation with me, and while he was inserting the stent where the block was, I could take a big breath in and out. There was a sense of relief, that heaviness like an elephant sitting on the chest feeling went away. I felt I could take deep breaths in and out. It was a big sign of relief. And then later in the day, typically since stent is a foreign body, body takes some time to adjust. So for around 2 hours, I went through a very difficult time, where I would breathe heavily, and my BP went a little overboard. It even touched 195 by 135, and so all the doctors team along with nurses They said this is common, like it's a foreign body, your body is trying to adjust to that foreign body. So just keep your nerves calm and like don't add to the anxiety. So I did that, and 2 hours was a struggle. And after that I saw that like my nervous system relaxed, and then I felt like little sleepy. And then probably I slept as well, and then the BP normalized, and I was very happy to see my BP readings on the BP monitor machine around 125 by 85, 120 by 80, 118 by 76, so which is wonderfully normal. So I'm very happy about it. Like, and then I saw that the feeling of heaviness in the chest, which I had all the time, a sort of constriction, that feeling went away, and I'm able to breathe well, which is a very important thing. Breath is the most important vital force for the body. So taking deep breaths in and out is very essential for the body and mind. So I was able to do that, and the big sign of relief I'm sharing with you, like it was a very important procedure, angioplasty, that I underwent on 23rd of September 2022. And with God's grace, with all the elders' blessings and friends' wishes, I came out strong and I'm feeling much, much better. Wanted to summarize and share with you. So thank you for listening. Have a wonderful day. Bye bye.